All right, we are going to get started. I know there's only a few of us on here right now, and a few more people bought tickets, but I don't want to keep you guys waiting. And we will be sending the recording out afterwards to everybody. So hopefully they will be on any minute. But welcome. As I'm sure you know, you are here for the Pregnancy and Nutrition webinar tonight. So happy Wednesday. If you don't know who we are Nourished Routes, and we are some local registered dietitians of Nashville, Tennessee. So I'm not sure where the people who purchase tickets are located here. If you want to put in the chat box, and feel free to do so. But we are so excited to have you here for this pregnancy and nutrition talk tonight. Really, our focus of these webinars is to educate the community on a variety of nutrition subjects at a feasible, affordable, low cost. So we really want to give you guys credible and accurate information on a variety of topics. So today we have chosen pregnancy and nutrition. I will give a disclaimer that I am not pregnant giving this webinar, but ironically, my business partner is. So we've been able to navigate through that almost together. My sister-in-law is also pregnant. So a lot of pregnant moms around me these days. Yeah, we'll dive right in. So if you don't know who we are, again, I know we have some new friendly faces on here. We are two registered dietitians. That is us on the right there. My name is Allison, and my business partner is Leah. We focus on real whole foods. So we are all about real unprocessed foods. We don't recommend like crazy fad diets or restricting yourself. We're evidence-based. We really rely on credible, accurate information, not necessarily Googling things. And we are results driven. So we really like to help our clients see the results and the goals that they want. And we believe that people can achieve their goals. So just what we're going to talk about today, we're going to talk about some nutrients of concern. We're going to talk about foods to avoid, side effects or implications of pregnancy. We're going to conclude the talk. We have a special offer for the new people on here. Whoops. A special offer for the new people on here, and then I'll take questions. So if you guys do have any questions, feel free to put them in the chat box and I'll answer them at the end, or we can answer them through follow-up email. So to get started, obviously as a dietitian, we're talking about nutrition today. So why is nutrition important? So adequate nutrition is important for crucial tissue formation, neurological development, bone growth, and more for your baby. So you're not only feeding yourself, but you're feeding a baby inside of you. And really what we recommend as dietitians, not only to a pregnant mother, but to really anybody, we recommend a balanced, nourishing diet. And that's actually why we founded our company name Nourished Routes, is because we really believe in nourishing yourself and nourishing your body. So going into the different trimesters, so what happens during these trimesters, they actually differentiate between each other. I know hearing first, second, third trimester, you really just think about the time between them, but there's actually some crucial differences. So this, for an example, is the first trimester is when your baby's organs, limbs, facial features, and placenta develops. So just a few, obviously very important, crucial items. The second trimester, those things that have been growing, so the organs and so on, they continue to grow and your baby gets bigger. And then in the third trimester, this is when there's a huge, intense growth and actually maturation of the organs, all these features that I've mentioned. And then really what's important in the third trimester is the brain growth that occurs, really extensive, and then the maturity of the lungs. So you want to make sure when the baby's born that it has the capacity to breathe, obviously, at its full capacity. So that's when a huge period of maturation for the lungs occurs. So next, we're going to go into nutrients of concern. So these are really important for everybody, but really for pregnant women. So first, protein. Protein helps with growth of fetal tissue, breast and uterine tissue, and increasing blood supply. If you think about your blood supply, it needs to increase because you're not only supplying yourself, your blood and your circulation, but now a growing fetus. So it's so important to have that protein to build that blood supply. How much protein do you need? You usually want to aim for 1.2 grams of protein per kilogram of body weight. So if you take your weight in pounds and you divide it by 2.2, that's your body weight in kilograms. Now multiply that by 1.2. Really tough math to do in your head, so I recommend having a calculator. But your protein needs do increase during pregnancy. So how do you get this protein? You might get it by servings of meat if you do eat meat, so 2 to 3 servings. We also recommend plant-based sources, so 2 to 3 servings of that. If you want to know how much meat in grams or ounces to have, the conversion is 7 grams of protein per 1 ounce of meat. And typically, if you think of the palm of your hand is about 2 to 3 ounces. So if you have 2 to 3 ounces of meat, you're getting a good amount of protein. Now, other sources besides meat, you can think of fish or beans, tofu, legumes, nuts, or dairy. So there's actually a variety of protein sources. If you are vegetarian or vegan, it's 100% feasible to meet your protein needs just through plant-based sources. But you do want to make sure you're focusing on protein a little bit more, just because meat eaters tend to have it or be able to hit their protein requirement easier. Next, calcium. Why is calcium important? And this is because it helps regulate bodily fluids. So if you think of what fluids do in your body, it helps lubricate organs, it helps transport nutrients. That's really important to transport things to your fetus. It also assists in productions of your baby's bones and tooth buds. That's so important during this time, because as your baby's bones are literally growing inside of its body and its tooth buds are growing as well, your calcium deposits in those bones and those tooth buds. It's recommended to have 1,000 milligrams per day. And just to give you a reference, 1 cup of milk has 300 milligrams of calcium. So if you are a milk drinker and you have just a couple glasses of milk, you're almost meeting your needs. Some other food sources are eggs and yogurt and cheese. But one thing to actually think of that I was talking about with a client today is there's a lot of sources of calcium besides dairy. So if you don't eat dairy, that's totally fine. There's calcium in dark leafy greens like kale and spinach. There's calcium in nuts. There's calcium in seeds. There's so many different sources of calcium. So if you do not have milk or dairy products, that's totally fine. But you may want to make sure that you're receiving an adequate amount, not only for yourself, but for your baby. So if you saw right here, actually, I mentioned the word pasteurized. So cheese and I said pasteurized dairy products. So what does pasteurized mean? A lot of people have heard this term thrown out there, but they don't actually know. So pasteurization is the process of sterilization that makes the food safe for consumption and may improve quality. So if you think of pasteurized foods, it makes it okay for a pregnant woman to have. If something is unpasteurized, someone may be able to eat it still, but it may not be safe for a pregnant woman because it may be harmful for the baby. So going into the next nutrient of concern, we have calcium. So calcium helps increase blood volume and decrease chance of anemia. This is the case for both pregnant and non-pregnant women. It's recommended to have 27 milligrams per day. You can get it from a variety of food sources like leafy greens, whole grains, lean protein sources like turkey, chicken, or fish. So there are a variety of sources. Really, the purpose of iron in terms of pregnancy is dealing with your blood volume and the increased blood supply that's needed. Next, going to folic acid. Folic acid and folate is something that we hear a lot during the beginning of pregnancy, and that's because it can really reduce the chance of neural tube defects. Now, you may or may not have heard of this term before. This was actually very prevalent earlier on when prenatal vitamins weren't a thing. So now prenatals really focus on that folate to decrease the chance of that. But there are food sources you can get it from. And just some examples here are fortified breads, oatmeals, fruit, spinach, peas, and beans. And these are just some sources, but a lot of women will take a prenatal, which will have this as well. So next, going to vitamin C. People don't really think about vitamin C being important during pregnancy, but it is. And this is because it aids in wound healing. First off, if you cut yourself or something, your body will always go into a fight mode. So it will put nutrients towards, say, whatever wound you have. And you want to make sure that you're sharing all your nutrients with your baby. So by having a sufficient supply of nutrients, it helps give you enough nutrients and also your baby. It can also help with bone and tooth development in the baby. Some examples that I'm sure you know of are orange and tomato, citrusy things, but also peppers and potatoes. So there are a variety of sources, and it's not just in orange or orange juice. Next, going into foods to avoid during pregnancy. I forget about these foods all the time, I feel like. Leah, my business partner, was actually just over, and as I mentioned, she's pregnant. And I said, oh, we should make sushi sometime soon. And she was like, I can't eat sushi, Allie. And I, not being pregnant, I forget about these things. So it's really important to make sure you're aware of what you can and cannot eat. So these are just some examples. So raw, undercooked, or contaminated seafood, such as sushi, like I mentioned, undercooked meat, poultry, or eggs. So whenever you get something, especially if you're not making it yourself, you really want to make sure you're cooking it through. And that's because you don't want to have any foodborne illness or something that not only affects you, but it could affect your baby. And then you also want to avoid unpasteurized foods like brie or feta or blue cheese. So as I mentioned that word pasteurized earlier, these are softer cheeses. It's really okay to have harder cheeses during pregnancy. And then some more unwashed fruits and veggies. So this is, again, just because of contamination. You don't want to contaminate or get yourself sick, let alone your baby. Excessive caffeine, which we'll go into, and then alcohol, which should be an obvious one. So going into cravings, the most common cravings are fruit, sweet, sour, and sharp tasting foods. So there's really a variety. However, a lot of people think, oh, if I'm craving ice cream, it must mean I'm deficient in calcium or another nutrient that is in ice cream. But however, there's little evidence that cravings denote a deficiency. It's just really your hormonal changes. Now, the most common aversions are actually coffee and tea. However, I've seen it be a variety of foods. I know Leah was really not wanting vegetables at all. I know another person who couldn't eat meat. They just, the thought and smell of meat really made them grossed out. So I think it just really depends on the person and your hormones, unfortunately. So it's very hard to predict. We're going to go into the side effects now, or the implications, but something I wanted to point out is that 7 out of 10 women have morning sickness during the first trimester. So obviously this is a very high amount, 70%. So it's important to know how to manage that morning sickness. So during morning sickness, you do want to eat small meals often. So not necessarily breakfast, lunch, and dinner, but maybe 5 to 7 small snacks or meals a day. You want to drink water before and after meals, not during, and that's because you don't want to fill yourself up. You want to eat plain crackers 15 to 20 minutes before getting out of bed in the morning. So this helps really settle your stomach. You want to make sure you stay hydrated. So not only food is important for nourishment, but also water. And then if you are having that morning sickness, you can sip on a lemon or suck on ginger to relieve nausea. I've had a lot of people do really well with this. And another thing that you could do is even get like a popsicle and suck on a popsicle. So during morning sickness, what you don't want to do, you don't want to lie down right after a meal. And that's because it makes your stomach unsettled. And then you don't want to skip meals. You want to make sure you're nourishing your body. And then lastly, you don't want to cook or eat spicy foods. That could just make morning sickness worse. Now, something also to note about morning sickness, which is luckily type of moment, is that you only typically have it during your first trimester. So it is short term, thank goodness. So one myth I wanted to mention is, you hear from a lot of people, you're pregnant, so you're eating for 2. The unfortunate thing about pregnancy, I remember learning this in grad school, is that you only need roughly 300 extra calories per day during the 2nd and 3rd trimester. Now, one of our interns may be on here, and I want you to note that this will probably be on your dietitian exam, because it was on mine, and I know many others. You really don't need many calories. Think of 300 calories. That could be one like Panera cookie a day or something. So it's really sad that you think that that people, including myself, think you could have a ton. Really not that much. A second myth, gaining less weight will make delivery easier. Unfortunately, for people who don't want to be gaining weight, this isn't true, and it actually can be detrimental. Not gaining enough weight puts the baby at risk of premature birth, which can cause heart and lung problems. So it's really not a great thing to avoid weight gain. Weight gain is so normal. You want to make sure you're giving your baby the adequate nutrients. How much weight is normal? So this really depends on your weight that you're starting out at, but it's really anywhere between 11 to 40 pounds. So if you've always been a tiny person, you've always been pretty slim, then maybe you will only gain about 11 to 20 pounds. Or sorry, if you're a heavier person. Now, if you're underweight, you may gain a lot more than that. So it really depends on the person. You should check in with your physician or your healthcare provider for individualized recommendations. This is definitely out of our scope of practice, but it is something to note. Next, going into constipation. So this is something that a lot of pregnant women have. The important thing with constipation is that you want to adequately hydrate yourself. So aim for at least 64 fluid ounces per day or 8 cups of water. You want to keep moving. And I say if allowed. So if you're not on like bed rest or something. So even if you're not working out during pregnancy, you could go for walks or even just move around the house or walk your dog or something to keep your GI tract moving. And lastly, you want to consume adequate fiber. So women need at least 25 grams per day. And food sources include fruits, vegetables, brown rice, quinoa, wheat bread, or nuts. So fiber is something that's really important to keep your stool moving throughout your body so that you're not constipated. So again, women need at least 25 grams a day. If you're having like a slice of wheat bread, usually that will have between like 2 and 5 grams. So it really relies on the fruits and veggies and the complex carbs that you eat throughout the day. Next, looking at diarrhea. So the opposite end of things. No matter what, again, you still want to make sure you're adequately hydrated. So aim for at least 64 fluid ounces per day. If you're having diarrhea, try clear liquids and don't have like soda or juice or something like that. Try the clear liquids instead. You could choose a bland diet. So this would be foods that don't have a lot of taste and kind of are easier on your GI tract. So for example, bananas, rice, applesauce, toast. You could even have like chicken with no sauce, just plain baked chicken or plain baked tofu or something, but really keep everything bland. And then some foods to avoid that make diarrhea worse are greasy and fatty foods, spicy foods, beans, and raw fruits and vegetables. And that's because raw fruits and vegetables have their fiber still intact. So it's really hard to break it down. So if you picture your stomach is already upset and you're trying to break down some fiber, then that will make it probably more upset. Next, going to acid reflux and heartburn. This is something I've heard that heartburn is horrible during pregnancy. And that's because your pregnancy hormones relax your lower esophageal muscles. So it doesn't have that normal effect. We recommend eating small, frequent meals and chewing slowly. You also want to make sure you're sitting up when you're eating, and then also avoiding highly acidic foods. So these are just some examples like citrus and tomatoes and dairy. Alcohol is obviously something you want to avoid, regardless if you're having heartburn or not during pregnancy, but highly acidic foods are really, they contribute to this. I know for a lot of pregnant women as well, your physician may put you on a medication, so you should consult them about that. Next, looking into caffeine consumption. So I told you we're going to come back to this. There's a myth that you can't have any caffeine during pregnancy. You actually can. The thing about caffeine is you need to watch how much you're having. So one thing about this is that if you drink too much of it, caffeine can cross the placenta and reach the fetus. However, 1 to 2 cups of coffee per day is okay to have. If you're having more than that and a lot of caffeine is reaching the fetus, then it may increase your risk of miscarriage. And then one thing to note, I know earlier I said you can only have 300 extra calories. You may want to consider the extra calories it may have if you're adding syrups, if you're adding different milks and things like that. So it may increase your empty calorie consumption. Next, going into alcohol consumption. This one is hopefully and probably obvious, but alcohol crosses the placenta And with the fetus, an immature liver cannot process alcohol. So this can lead to fetal alcohol syndrome, which is not a good thing. We recommend abstaining. There's not really any research hard hitting on no safe level. I know some people have said you can have 1 to 2 glasses at a time, or 1 glass at a time for women. But, I personally would recommend abstaining, just because there's not a lot of research out there. So I know one person asked about breastfeeding. So we have had this just come up again, not necessarily during pregnancy, but afterwards. So one thing we wanted to bring up about energy needs while breastfeeding, and this is something that's really important because a lot of women actually lose weight while breastfeeding. And that's because your breast milk supply 400 to 500 calories daily, and you end up using the remaining calories from weight gain during pregnancy. Breastfeeding is not the time to diet though. So we recommend adding 200 to 300 calories daily. So instead of having your baby and saying, well, now is my time to diet, you still need to keep up your intakes so that you have good milk supply. Women who restrict intake may reduce their milk supply, which is obviously not a great thing. The nutrients in your milk is crucial for your baby, and you don't want to be deficient in anything. So think about it this way, that everything that you're taking in, your baby is getting through the milk, and then 1 pound per week is a safe goal for breastfeeding moms. So really just that 1 pound per week weight loss, if that's what you're wanting to do. Now we do have a breastfeeding guide up on our site for those who are interested in this topic further. All right, so in conclusion, you can tell what we have been focusing on here. Really a healthy, balanced diet is what we recommend for pregnant women. Those with a, quote, normal BMI are more likely to have uncomplicated pregnancies and delivery. However, I want to add a caveat to that BMI is not necessarily a good indicator of health, and it's really important to consult your registered dietitian and consult your provider about this and what puts you at risk of complicated pregnancies and deliveries. A man's nutrition before conception is also important. So you should speak with your husband if you're trying to get pregnant. And I know there's foods and things that promote fertility, not only of your eggs, but also of sperm. And lastly, consult with your physician and a dietitian to understand your specific nutrition needs. So an example of this is I was talking earlier with a client who was looking to get pregnant, and we were talking about her calcium needs. So it's really important to make sure that you're getting adequate nutrition while you're pregnant, but also beforehand. Oops. So I know we have some new faces on here. We did want to offer you guys a free session with with myself, or with my business partner, Leah. And this really just helps to clarify your vision for health, identify barriers to meeting your goals, and more. So if you're trying to get pregnant or you're already pregnant, we're here to chat with you about what's working and what's not, and really how to help you with that. So you can schedule that using that link there, and we'll also email it out to you guys as well. Recommend following us on Instagram and Facebook. And we also have a monthly e-magazine called Nourished News, which really gives up-to-date articles and information in the nutrition world. And then lastly, any questions?